All right, guys, we'll go ahead and get started. If anybody wants to join in later on, they can. All right, guys. So thank you guys for joining the webinar tonight. For those of you guys that don't know me, my name is Carlos Omana. I am the owner and founder of Whitewater Method. We are a company that provides strength and conditioning programs specifically for swimmers. For my swimming career, I swam at the Metro Aquatic Club of Miami under Kirk Pepis. I had the privilege of swimming at the University of Florida under Greg Troy and Anthony Nesty. And after my collegiate career, I was privileged enough to swim to represent Venezuela on the international stage. So the goal for tonight's webinar is basically to just share some practical tips and strategies that you guys can implement with your swimmers to help them keep their shoulders strong throughout their careers. The presentation is intended to be kind of a baseline surface level webinar, but it's intended to give you some practical stuff that you can implement right away. Okay, so. All right, so a couple of objectives for today. So we want to gain a better understanding of the kinetic chain and how each portion of the body integrates with one another. We want to understand the importance of the fail safes regarding the shoulder. We're going to learn the difference between force production and force management and how that relates to shoulder health. We're going to identify what the upper cross syndrome is and solutions to get a swimmer out of that position. And towards the end, we'll review some proper exercise, positioning, and execution to make sure you're getting the best bang for your buck. Okay. And then we'll save some time at the end for some questions if you guys have them. Okay. So let's go ahead and dive in. So the kinetic chain. So the body is often referred to as a kinetic chain. So what does this mean? It means that everything in the body is interlinked, just like one chain affects the other, affects the other. If one chain moves, the rest of the chains are going to move. So in this case, the chain that we're looking at is always going to start at the center of mass of the body. So that's going to be the core musculature here. In the case of the shoulder, that chain is going to move up into the thorax region here, going into the shoulder, and finally into the lower arm. Okay, now when we're talking about the kinetic chain, there are two things that I'm going to be talking about throughout the presentation. It's going to be structure, and we're going to talk about muscle. Okay, now what I mean by structure is simply just bones and ligaments. Now, bones and ligaments by themselves don't provide any movement. They just provide the vehicle for which muscles and tendons provide the force to create movement in space. Okay. Now, when we're talking about movement in space, we're going to use the analogy of a parachute to better understand how the shoulder works. Okay. So anybody who jumps out of a plane will have their main parachute that they hope will get them to the ground safely. But nobody's going to jump out of a plane without a backup parachute. Okay. That backup parachute is their fail-safe, just in case the main parachute is not open. The shoulder is very, very similar. So when we're looking at the fail-safes, we're going to look at fail-safe from structure, so bones and ligaments, and we're looking at fail-safe from a muscular standpoint. Now, all the fail-safes are going to start, again, like I mentioned earlier, from the inside out. So we're going to start in the structure with the lumbar spine and the pelvis, which is your center of mass, and the relationship between these two. We'll move up into the thoracic spine and its relationship with the rib cage and the scapula, and then move a little further into the scapula and its relationship with the humerus. Now, when we look at the fail-safe from a muscular standpoint, it's going to work exactly the same. So the muscles that we're looking at in the center of mass are going to be the diaphragm, the core, and the glute max. Then we'll move up into the muscles that attach onto the rib cage and the thoracic spine, which will be your upper back and your serratus anterior, and going into more into the shoulder, into the rotator cuff, and then finally into the bicep and tricep. Now, each one of these fail-safes from the outside in now is dependent on the more proximal, or we call it the main parachute, to function properly. So for example, if we're going to look at the relationship between the rotator cuff and the bicep and tricep, if the rotator cuff is dysfunctional or it's weak or has something going on that is hindering its performance, now the bicep and tricep are going to have to pick up more work, which can lead to discomfort, can lead to pain, and unfortunately can lead to injury. It's going to work the same way here. So if the thoracic spine or the rib cage are not functioning properly, it can affect the scapula and the humerus moving outwards. Now, when we're looking at these muscles, you might be asking yourself, where are the lats? Where are the pecs? These are the big time muscles that produce a lot of force, and these are the ones that typically get us from point A to point B in the pool. They're obviously a part of shoulder function, but we're going to categorize them in a different portion of shoulder health and shoulder function later on. So now, like I said, the center of mass, all muscular functions originate at the center of mass of the body. So typically the center of mass of the body lies just above the pelvis. It might be a little bit higher or a little bit lower depending on how long the swimmer's legs are, but it's roughly in that core area. Now, the main muscles that stabilize your center of mass are going to be your rectus abdominis, so your ab muscles, and your glute max, essentially the glutes that move your legs. Now, we're not going to dive too deep into these for the sake of the webinar to keep it shoulder, but just know that if the rectus abdominis and the glute are strong and stable and functional, then the body's going to have a better chance of having functionality moving upwards in the chain. Now, the one muscle that we are going to talk about is the diaphragm. Now, the diaphragm, I can consider it the first outer layer of shoulder function beyond the center of mass. So the diaphragm is a muscle that kind of lies under the rib cage and right under the lungs. Now, what the diaphragm does, when you take a deep breath in, it's going to contract, and when it contracts, it's going to flatten, okay? What that's going to do is create space for your lungs to expand. If your lungs can expand, then your rib cage can expand. If your rib cage can expand, then your thoracic spine can extend, so on and so forth. So all functions of the shoulder are going to start right here from a muscular perspective, and that's going to affect the rib cage, so on and so forth. Okay. Now, to simplify how the shoulder works, I like to categorize muscles into force production and force management. So what's the difference? Force production requires a lot of thoracic flexion, bringing the shoulders forward, having internal rotation of the shoulder. So imagine turning your palm so it's facing backwards and you're pointing your thumb behind you. Okay, that is a force production position. Okay, think of like a boxer throwing a punch, a baseball pitcher, even finishing the stroke in the butterfly in the back requires some degree of that position. Okay, now force management is the ability to achieve opposing positions to be able to manage the high forces that are acting on the shoulder through force production. Okay, now when we're talking about force production, the main muscles are going to be your lats and your pecs. The lats and the pecs are the biggest and strongest internal rotators of the shoulder. So no wonder they're very good at getting swimmers into this position. Now, that doesn't mean that it's bad. It just means that we need to be able to mitigate those forces, which is where force management comes in. The relationship between force production and force management, for force production to happen, you need to be able to achieve force management to load these muscles. Loading just basically means that we can actually use the muscles the way we intend to use them. Okay, so when we're looking at the lats, the lats attach to the spine, onto the pelvis, and onto the arm bone here, the humerus. So its main functions are going to be to internally rotate the humerus, so bringing that thumb in and backwards, adduction, so bringing the arm from the side closer to the midline of the body, and extension, so imagine I have my arm out in front of me and I'm driving that arm straight back. Now the loading requires force management, so we want to be able to achieve the opposite. So instead of internal rotation, to load it, we want external rotation, we want abduction, we want flexion, or some degree of all of them. Okay, doesn't mean that we have to live in one plane going in one direction. There can be some degree of all three. And then when we're looking at the pecs, so pec major and pec minor, very similar, very good internal rotators of the shoulder. So pulling the shoulder in, flexion, so bringing the arm out in front of you, protraction, so that means I'm bringing my shoulder blades forward, kind of, again, that force production position, and adduction, so bringing the arm closer to the midline of the body. And again, it's going to require a lot of external rotation, abduction, retraction of the shoulder blades, so bringing those shoulders back, or some degree of all of them. Now, although the lat and the pecs are very good at producing force, like I said, we need to be able to mitigate those forces. If those forces are not mitigated, the body can end up in a poor posture position called upper cross syndrome. So, upper cross syndrome is categorized as, that kyphotic posture, shoulders rounded forward, thumbs pointed in. It can cause shoulder pain, neck pain, low back pain. What this basically means is that your lats, pecs, and even your upper trap area become really overworked and tight, and your force management muscles, so like the muscles of your upper back, your rotator cuff muscles, are too weak and underworked to be able to pull the swimmer out of that position. So a lack of thoracic mobility because they're in this kyphotic posture, so they're constantly hunching over. Like I said, weak upper back, weak serratus, and weak external rotation. So what we want to do here is be able to take some pressure off the pecs, the lats, and the upper traps, so we can get them out of this position and slowly start strengthening the muscles of the upper back, rotator cuff, and the serratus. Okay. So now this is going to lead us right into our force management muscles. So now that we've covered our force production muscles, we're going to go and dive deep into the force management muscles, what they do, and why they're important. So the first fail-safe, if you will, is the thoracic spine and its relationship with the rib cage and the scapula. So we know the lats and the pecs are very good internal rotators and flexors and bring us into this bad position. So if we're looking for force management, we want to get out of that position. So what we're looking for, the thoracic spine right here, where all the ribs attached to, is to be able to extend that thoracic spine, which will allow the rib cage to extend, which will allow the shoulder blades to retract. So it's all going to start here, but it has a relationship with both of these. Now, what that's going to do is going to facilitate the muscles in the back to be able to relax and contract efficiently, to be able to get stronger and do what they need to do. So in terms of structure, we're looking at the thoracic spine, we're looking at the rib cage, and we're looking at the scapula. Now, the muscles that we're looking at here for force management are rhomboids. We're going to look mostly at the fibers of the mid and low traps, and we're going to look at the serratus anterior. Now, the fibers of the mid and low traps and the rhomboids, what they're going to do is they're going to retract the shoulder blades, so bring those shoulders back and kind of downwardly rotate the scapula to really puff that chest up. As long as these muscles can contract and relax accordingly, we can allow these muscles to get stronger and pull the swimmer out of that position to get them into a more functional position. Now, the serratus anterior is a muscle that attaches to the scapula and onto the ribs. It brings the shoulder blade forward and upwardly elevates this one. Now, this might seem counterintuitive because that it's more of a force production position, but when we're looking at most swimmers, when they try to get overhead, they usually have a hard time using the serratus. So instead of using this and protracting the shoulder forward, they're going to go up and use their upper trap to find that range. And that's typically why a lot of swimmers have these knots in the neck and upper trap that are really hard to get rid of. This is why. Typically, the serratus will be weak, and then now the trap starts to take over to find the path of least resistance to get the swimmer from point A to point B. So next, we're going to look at the scapula. Now, we're going to dive kind of deep into this one. So the relationship with the scapula is interesting because it has muscles that attach to it, that attach to the spine, but it also has muscles that attach to the scapula and to the humerus. So it has a dual function here, okay? The muscles that attach directly onto the scapula are your rotator cuff muscles, okay? So there's 3 in the back and there's 1 in the front that's not pictured here. The one in the front just kind of lays in between the rib cage and the scapula. Now I'll go all three. So supraspinatus, the one up top, superior, inferior. Infraspinatus is going to be the one on the bottom, and then your teres minor. Okay. Supraspinatus is basically going to work with medial rotation. So essentially, the first couple degrees of bringing your arm out to the side, and then infraspinatus and teres minor work in external rotation of the shoulder. These two are the main ones that we're focusing on here. Now, when we're looking at external rotation of the shoulder, they're both going to be working all the time, but depending on what position the shoulder is in, one might take over a little more than the other. So if the arm is out, it's just next to your body, and you go into external rotation, the infraspinatus will be doing most of the work. If your arm goes into some abduction, now the teres minor is going to take over a little bit. Doesn't mean that this one stops working. It's just, hey, there's a dominance here or a dominance there. Now, the subscap, the muscle that's not shown here, works in internal rotation of the shoulder. We won't go over too much on that one because it's already putting us in a position that we don't want to be in, but we don't want to neglect it entirely because the subscap is going to keep the humerus in place. And if that muscle tends to be weak, now the humerus can get out of place and elevate, which can start to get this impinged, the supraspinatus impinged on the acromion, which is typically known as a rotator cuff impingement. Okay, so they all serve importance, but for the sake of the presentation today, we're going to look at mostly the infraspinatus and the teres minor. Now, our last fail-safe is going to be the humerus and the bicep and tricep. Now, the humerus, its relationship on the shoulder blade, that relationship is considered the most mobile joint in the entire body. It can move in almost freely in any direction it wants to because of its very shallow ball and socket joint anatomy. Now, all the movement here is controlled through the rotator cuff. But again, if there's dysfunction in the rotator cuff, then the bicep and tricep are going to start to take over. So the unique part about the bicep and tricep is that they attach to the forearm and they attach to the actual shoulder blade. So biceps going to attach more towards the front. Tricep is going to attach to the posterior spine here. Okay. Now, the biceps' primary focus is to supinate, flex the elbow, and flex the shoulder since it attaches to the actual shoulder blade. The tricep is going to extend the elbow and extend the shoulder. Typically, the pain that we see among swimmers is going to be in the front of the shoulder here in that bicep tendon area. If your rotator cuff, for example, is very weak, now we're going to end up in a position where your shoulder is tilted in and possibly forward, placing unnecessary stress on that bicep tendon, which there is an aspect of making sure your bicep is strong enough to withstand those forces. But like I said before, the fail-safe is the main parachute is not doing what it's supposed to do. So now the shoulder is relying on its fail-safe for stability. So the shoulder literally doesn't fall off the body. Now we're going to switch gears here a little bit. Now we've covered kind of our fail-safes. We're going to move into how exactly we want to load and train some of these movements to make sure that the shoulder of your swimmers stay healthy. Now, the body is very, very, very good at finding the path of least resistance. Okay. And in order to know that we are doing what is appropriate, we have to make sure that we are aware of the compensations that the body wants to get into in order to make the movement easier, but not more efficient. Okay. Now, with that being said, like I mentioned earlier, the body does not work in isolation. So it's impossible to completely isolate any joint or muscle. So what we're looking for is more so limited movement. So when we do shoulder strengthening exercises, specifically for force management, we're going to look for thoracic spine extension, flexion, and rotation with limited lumbar involvement. We're going to look for scapular protraction and retraction, so bringing those shoulder blades forward and back with limited elevation. So this is a position we don't want to be in. We're looking for humeral internal and external rotation with limited scapular movement. And we're going to look for elbow flexion extension with limited humeral internal and external rotation. Okay. Now, one of the mottos that we use at Whitewater Method is it's not what you do, it's how you do it. Okay. So any movement that you prescribe for a shoulder or for a hip, for a back, whatever it might be, can either be very, very good or very, very bad, depending on how the swimmer is performing this movement. Okay, so for the sake of today, we're going to take a face pull. Okay, so if a swimmer is performing a face pull correctly, we're going to look for, if this video would play. So not sure why this isn't playing. Either way, guys, so we're doing a face pull action. Okay, for the face pull, we're trying to get into retraction of those shoulder blades. We're trying to get into extension of that thoracic spine to be able to bring those shoulder blades back. Okay, so essentially working the upper back musculature, working the rotator cuff musculature. Okay, if let's see if this plays again. I'm not sure why this isn't playing. I apologize, guys. These videos were playing earlier. So what we're looking for, if the swimmer is going to perform the face pull appropriately, we're going to look for thoracic extension. Okay, we want that rib cage to expand as well. And we also want those shoulder blades to retract appropriately. Okay. Now, that would be an ideal position to be able to load the upper back musculature, be able to maintain rotator cuff stability, and get what we want out of the movement. Now, if the swimmer is performing it in a kyphotic posture because they're getting extension instead of the thoracic spine, they're getting it from their lumbar spine. Now their thoracic spine is going to have a hard time getting into extension, so those shoulders might be dumped forward. Now we're getting into a position where the body's compensating, and it might put unnecessary pressure on the front of the shoulder here. So we can use the rest of the body to find and stabilize positions here. Okay. Now, what that means is I can ask the swimmer, hey, you're going to get a glute squeeze here. We're going to squeeze our glutes as hard as we can to make sure that our lumbar spine is in flexion and it's not getting involved. And we can stabilize our center of mass so that everything else up the chain can work more appropriately. Okay, so if I can get a glute squeeze and I can maintain that center of mass, that main parachute working, that's going to give us a better chance of getting into scapular retraction, bringing those shoulder blades back so that the rotator cuff can do what it needs to do to stabilize the humerus in space. Any of you guys tech savvy? Man, I don't know why this isn't playing.
How did you add it to the slide? Where did you have it downloaded?
I have it downloaded on my Google Drive and then just upload it that way.
Maybe you can play it through the drive.
Yeah, maybe. Let me see. Give me 1 second, guys. This is not supposed to happen. Weird. I apologize, guys. These were playing earlier. This is weird. Hmm. Let's see if there's any way I can play this. We'll use this, guys. So, in terms of mobility, the first thing we want to get into is kind of loosening up the areas that, and when we looked at when we looked at upper cross syndrome, the areas that are causing trouble. So the lats are the biggest muscle that are causing internal rotation of the shoulder. So we want to loosen up this, and I'll give you guys an extra movement here, the thoracic spine extension, which we'll go into next. So this is something you can implement with your swimmers right away. So what we're looking for when we looked at the screen earlier, we were looking at what the lat does and how we're actually going to load it. So if we're going to stretch a muscle, we have to stretch it the same way we would load it. So lat is very good at internally rotating the shoulder. It is good at adducting the shoulder, so bringing the arm closer to the midline of the body, and extension. So if it's in the front, bring it forward. So when we're going through this movement, I'm going to grab a rack, pull something stable with the palm facing in and the elbow facing in. So I've got my external rotation here. I'm going to walk my feet back as far as I can and push my hips back. Now I've got flexion, so it's the opposite of extension. I want to create as much distance between those 2 points as I can. So I'm going to step back and around, and now I'm going to rotate towards this arm to create some degree of abduction. Okay. Now, this is the end position that we're hoping to get to. But depending on the swimmer, it might be without stepping back, or it might be without rotating, or simply just leaning back might be enough of a stretch to get them what they need to get to. Now, we'd like to get to this point so we can really loosen up that tissue so we don't end up in that kyphotic posture. But the most important thing is meeting the swimmer where they're at. Okay. So this will be the ending position. Now, for the thoracic spine extension, so a very common movement that's prescribed for thoracic extension is being able to extend over a foam roller, usually with your feet down. Now, that's a great exercise as long as the extension's coming from the thoracic spine and not from the low back. So to kind of take the guesswork out of it, we ask our swimmers to place their feet up against the wall, bring their hips close. What this is going to do is going to place their lumbar spine into flexion. So it's going to limit a lot how much their low back can compensate here and get the movement. They can have their hands behind their back. If it's a swimmer that has shoulder issues, instead of having it here, they can also have it on their chest. That's totally fine. I would ask the swimmer to take a deep breath in, and then when they blow their air out, they're going to drive their shoulders back and chest up. And at least here we know, even if they have limited movement through the thoracic spine, we know we're actually mobilizing the thoracic spine here. Okay. So again, it's not necessarily point A to point B. It's, are we getting what we actually want to get out of these movements. Okay. And then, of course, if they progress to a point where they have a lot of mobility here, we can progress them to their feet down because we know they can achieve that position without having their feet up against a wall. Now, for scapular stability, so the muscles of the upper back and the serratus, there's two movements we can go over. We can go over a prone T and we can go over a plank plus. So for the prone T, I'm going to ask the swimmer to lay prone. Okay. I want to have their arms out to the side, either next to the shoulders or slightly under, depending on what they can tolerate. And I want them to point their thumbs up towards the ceiling to facilitate external rotation of the shoulder. So essentially locking it in with the rotator cuff. Now we're going to use the rest of the body. I'm going to ask the swimmer to squeeze their glutes to make sure their center of mass is stable. And then in that position, I'm going to ask them to reach up and reach out and up to be able to retract the shoulder blades. Now, if the swimmer can perform this movement correctly, they should be able to get some degree of thoracic extension, scapular retraction, and be able to maintain this position. Okay. If the swimmer can maintain that position, then this is a movement that's appropriate for them. And we can begin to load that movement to move the swimmer towards a stronger force management. Okay. Now, a couple of compensations that we want to be aware of here. Okay. The first one would be hyperextending of the low back to kind of lift that chest up too high. Okay. In that case, the body is looking for a different path of least resistance. Okay. The body is using structure instead of muscle to create movement. And that's an indication that the upper back is weak and has a hard time retracting those shoulder blades. Okay. Another indication of a weak upper back would be instead of being able to maintain this position, those arms start to get lower and lower close to the hips as those arms come up. Okay. That's a compensation. We're trying to bring the arms a little bit closer to the center of line of the body, shortening that lever so that this can retract. It's not necessarily bad because they can probably still get that retraction, but it's not what we're looking for initially. Okay. And then another one would be leaving the shoulders behind, but getting those arms way overhead. So thinking point A to point B instead of getting those shoulders back. Now, that can be an indication of upper back weakness, but that can also be an indication of rotator cuff external rotation weakness because they have a hard time maintaining this externally rotated position of the shoulder.
Carlos, can you touch on breathing through this exercise a little bit?
So breathing in this exercise is not going to be a huge concern because we're not getting a ton of movement here through the thoracic spine. Truthfully, I would just ask them to breathe out, to exhale as they're lifting their arms up. But in this case, it might be splitting hairs just a little bit. But when we move into the plank plus, it's going to matter a little bit more. So, where are you? Come on. So for the plank plus, okay, you're going to set yourself up you're going to set your swimmers up in a push-up position. Now, the push-up position can either be on flat ground or you can do it in an incline, like on a bench, on a box, depending on where the swimmer is at. So if they can demonstrate good shoulder stability, we can do it on the ground. If it's a swimmer that's either really young or doesn't have a lot of strength, we can start them in an incline. Okay. I want your body to be in a straight line. We want to get a squeeze of that glute to make sure that our center of mass is stable. I want to have your arms a little bit wider than shoulder width and elbows locked out. Okay. Now in this position, I would want nothing else to move except the shoulder blades. Okay. So I would ask them to extend the spine, squeeze those shoulder blades together, and push them forward at the top. Okay. Now, a few compensations here would be kind of bending those elbows because they're looking to get from point A to point B instead of just focusing on scapular protraction and retraction. So that would be an indication that our serratus anterior needs a little bit more strength work. Okay. Another compensation would be instead of getting movement going forward and back, we might get some elevation. Okay, because it's easier that way. And we're working against gravity here. That would mean we have an upper trap compensation. It could also mean that our low trap fibers might be too weak as well to maintain that downward position of the scapula. Now, when it comes to breathing, Brian, there's two ways you can go about this. Okay. If your swimmer is somebody that just needs strength, you can inhale as your shoulders come back, and you can exhale as your shoulders go forward. If you have a swimmer who their scapula is starting to wing out, you watch them from behind, their shoulder blades are kind of poking out. That means that there's a disconnect between how well the scapula glides on the rib cage. So in that case, yes, we want to strengthen the muscles of the upper back to kind of improve that function, but we also want to close the gap of the ribs on to the scapula. So you could take a big inhale on the way up. So as you push up, expand that rib cage so that the rib cage comes a little bit closer to the scapula. Does that make sense? Okay. Now, the rotator cuff. So a sideline rotator cuff exercise here is going to target the muscles that we spoke about specifically. It's going to be the infraspinatus and the teres minor, the two main external rotators of the shoulder. Now, since we're sidelining and the arm is in 0 degrees of abduction, the main one would be the infraspinatus. Okay, that does not mean the teres minor is not working, but for the sake of shoulder health, typically we would start a swimmer in this position because if it's a swimmer that already has shoulder discomfort, getting them into some degree of abduction might cause pain initially. So we'll start regressed, and we can always move up. But I would rather start too regressed than too progressed. Okay, so I would have the swimmer lay on their side completely. We could also have them up against a wall. I would have their elbow tucked by their shoulder, elbows at 90 degrees. Now, I want their body to stay still, and I'm simply just going to rotate that arm up without either pushing that shoulder blade back or rolling back. Okay. Now, I'm not judging necessarily how high this dumbbell gets. What I'm judging is that we simply get the movement through the humerus. Okay. There's going to be there should be very limited movement through that shoulder blade, and there should be very limited movement rotation. So if we see that the swimmer, even with no weight, has a hard time lifting that arm, but the shoulder starts taking over and retracting to create more range of motion, that's an indication, hey, this swimmer has a rotator cuff external rotation weakness. Same thing if they're trying to roll back. Now, it's another compensation, but a different degree because it's now past the main parachute. It's going into another one, moving more inwards towards the body. In this case, the only one that would be concerned about is if it's no weight and there's no compensations, but they really can't get that arm very, very high. They're either extremely weak and they really need some strength work in that area, or there's a external rotation mobility deficit. So that's just a mobility issue. But you can determine that depending on what you see going on in the movement. What we're looking for is just to limit compensations in the movement more than anything else. Now, when we look at elbow flexion and extension, so there's a few videos here that I want to show. So we'll look at these first. So when it comes to the bicep and the tricep, these movements are going to be highly, highly dictated upon the position of the body when the elbow is in flexion extension. So can the shoulders maintain proper spinal position as the elbows go into flexion extension? So can the thoracic spine extend? Can those shoulder blades retract? And the humerus externally rotate to withstand those forces to maintain position. So in an appropriate tricep extension, we can maintain that position. There's very limited movement, and we know that the main parachutes can withstand the forces acting on a further failsafe. Okay. Now, we see people in the gym doing tricep extensions like this all the time. Now, if you want to be big and strong, there's nothing wrong with that. That would work just fine, and you can really hit the tricep and really build some muscle that way. But if you want to get big and strong long term, we want to stay out of this position because it gives us very little input as to how well the body is handling those forces and where those forces are going. So at least here, even if the weight that we're using is less, we know that the main parachutes can withstand those forces, and we're not compromising the position and the muscles and tendons here. Okay, so even though this, you might be able to carry more weight, now in this position, the humerus is dumped forward, the bicep is under significant pressure, we're in that force production position. Okay. The same thing goes for a bicep curl. So not that one, but I'm gonna leave that one later. So for a bicep curl, can they withstand the forces acting on elbow flexion here? Can we retract the shoulder blades? Can that thoracic spine extend and maintain position as the bicep is loaded to make sure there's not unnecessary pressure on the front of the bicep there? That is commonly seen in that upper cross syndrome where we have that kyphotic posture. Now, when we're looking at compound movements, this is where it starts to get interesting. So this is basically putting it all together. Any kind of pull down variation is a good indicator of how well the shoulder is working. So in this case, we're going to use a pull up. So for the pull up, the starting position of the pull up is going to be internal rotation of the shoulder. We're going to have some degree of scapular elevation and some degree of thoracic flexion. So the starting position is a force production position. Now, what we're going to look at here is how well can our force management get us out of this position so that the lats can do what they need to do without putting unnecessary pressure on the shoulder. So in this position, I have to externally rotate. My scapula has to depress, and there has to be some degree of thoracic extension so that there's not unnecessary pressure on the shoulder. The lats are what driving me up towards the bar up top, and I can complete this movement pain-free. Now, what does this have to do in relation to swimming? So when it comes to swimming, this is a video of Michael Phelps and Fabian Gillot at the 2016 Olympics. Okay. So if we're looking at this position right here, okay, this right here is a degree of internal rotation of the shoulder. There's some degree of scapular protraction and elevation. And since this shoulder is pulling through and we're going into extension, now this part of the thoracic spine and the rib cage is going into flexion. So how well can his force management muscles pull him out of that position? So he's going to go into, as he pulls down, external rotation so he can get his arm through. He's going to go through a full range of that scapula to be able to retract and depress it. And as he finishes his pull, he's going to go into extension of that side, leading into flexion on this side. So again, we want force production. That's what's going to get us from point A to point B. But without force management, we're not going to be able to produce force for very long, pain-free. So essentially, it's a repetitive motion of can the body produce force? Can the force management maintain that force as a swimmer goes through their race at high speeds? So it's a repetitive motion. Now, obviously, the pull-up is not identical to what Phelps is doing here, but it has the same concept of, okay, if I want to load these muscles, can I load them appropriately without having compensations and without putting unnecessary stress on the shoulder? So we'll go ahead and put it all together, guys. So if you can achieve proper force management, you'll have stronger shoulders, you'll have healthier shoulders. If force management is going to allow for appropriate force production, okay? They work in unison, and you need force management for force production. Force production by itself will place the swimmer in a compromised position that can harm their shoulders long term, okay? When we're addressing shoulder function, we always want to start from the inside out and from the inside and work your way out. And it's not necessarily what you do, it's how you do it. Okay. Now, every movement is designed to provide information on what is going on with the swimmer, but not every movement is appropriate for every swimmer. So, kind of like the plank plus, is flat ground appropriate? Is at an angle appropriate? The single most important aspect of choosing the correct movement is meeting the swimmer exactly where they're at. Okay. Exercising correctly is more effective than any corrective exercise out there. Okay. All right, guys. I'll give you some time to open up for questions if you guys have any.
Getting back to what I was getting to before, with the breathing, when on the arms coming back, is that's one of my concerns with a lot of swimmers, is that they're just trying to pinch their scapula together.
Yep.
Thoughts on inhaling while raising the arms to help kind of like force their awareness of the scapular position.
Yeah. So with the breathing aspect, if you ask them to exhale, it's going to allow the rib cage to kind of be more free through movement in that case. There is a utility to taking a deep breath in to expand that rib cage. But in that case, we want to get some mobility because we're producing force. Cueing is the most important thing with that exercise. So instead of telling them, hey, we're going to have your arms out to the side and you're going to lift and squeeze your shoulder blades, just tell them to raise their hands towards the ceiling. Okay. That's why I tell them to reach out and up. If you tell them just to reach up, yeah, they're going to get just the retraction. Tell them to reach out and up. Now we're going to get the retraction and that downward depression. So, not that just getting the retraction is bad at all, because you're still working the muscles that we want to strengthen, but it's kind of that aim small, miss small mentality where it's, hey, these little details matter, especially if we're going to start producing high rates of force in the pool. So this is something that you could do before practice to improve the position of the shoulder before you even get started. Okay. Typically, with swimmers that we deal with, the swimmers that do this prep work and take care of their position before they lift, before they swim, a lot of times they don't need as much of a warm up. They might do it still because it's part of practice, but it might not take them 500, 600, 700 yards to really get loose. It might take them 2 or 3 because they're already in the position they want to be in. And now we don't have to do this excess yardage to loosen up the soreness. And no, we're in a position that we want to be in to start producing force. And if you do this over time, now it's not a temporary position. Now we've built strength to maintain that position. Does that answer your question, Brian?
Yep. Perfect.
I have one question. So you went over for the rotator cuff, the extensions on your side. Is there more exercises for directly improving the impingement that's in the front, the bicep one?
So the impingement in the front it's going to dictate, it's going to be dictated by what's going on at the rotator cuff and then what's going on moving in, right? So if there's a lot of pressure in the front of the bicep, that means that that main parachute is failing. So now this parachute is taking over for more than what it's supposed to, right? So let's assume that let's take the bicep tendon, for example. The bicep tendon is supposed to be able to run free. It's not supposed to be impinged. It's not supposed to be in a compromised position. So if the rotator cuff, for example, which is the main parachute, can't maintain a proper externally rotated position, now it's going to be more internally rotated. If it's internally rotated, now it's going to dump forward and it's going to place that unnecessary pressure. Now, if let's assume the rotator cuff is perfectly strong, but we have a thoracic mobility and stability issue, right? Our upper back is weak, our serratus is weak. Now, even though we can get external rotation, that shoulder blade is still dumped forward. So it's, again, you have to start from the inside and work your way out. If you're looking to improve function out, I would start with kind of like the prone tees. You can start with face pulls. You could get creative, but just keep the goal, right? We want to strengthen scapular retraction and thoracic extension. And then once you have that strength and that stability, then we can start focusing if we need to. Hey, do we need some external rotation of the shoulder? Is it actually a bicep problem? You know, because if the swimmer's in the correct position and they're strong and they're not in this kyphotic posture, then okay, we've ruled out those possibilities. Now it really might be a bicep problem, and we can address it at the source. But more often than not, the bicep is just placed under unnecessary tension because function moving in on the shoulder is dysfunctional. Does that make sense? That answer your question, Alex?
Yeah.
Will, do you have a question? Anything? Any other questions, guys?
Not really a question, but I'll probably be reaching out to you in the not too distant future because I got a slightly different thing going on with one of my athletes, but I'll fill you in on that later.
Sure. Sounds great, man. All right, guys. If there's no more questions, thank you guys so much for tuning into the webinar tonight. If you guys have any further questions, or you feel reaching out, you can reach out to me through Whitewater Method on Instagram. This is our email. Our website is whitewatermethod.com. Okay. Thank you guys again. Have a good night.
Thanks so much, Carlos.
Thank you, Carlos.
Guys.
Take care, man.